Thank you everyone in the audience, and thank you to our panelists for joining the World Stem Cell Summit. I'm very excited to be able to host this event. My name is Dylan Livingston. I am the founder and president of A4LI, the Alliance for Longevity Initiatives. We are a 501c4 nonprofit organization aimed to advocate for legislation and policies that will increase healthy human life expectancy in the U.S. Today we are going to be discussing the role of government in policy and legislation in achieving longevity for all. So our first guest here will be Bernie Siegel. Bernie, can you introduce yourself briefly?
Sure. I'm Bernie Siegel. I'm the executive director of a nonprofit regenerative medicine foundation that has a mission of accelerating regenerative medicine to improve health and deliver cures. Also, I am the founder and chair of an annual meeting going, I think, about 20 years called the World Stem Cell Summit. We have a real trusted network of researchers and stakeholders in the field of stem cells, which intersects very nicely and importantly in the world of longevity. By background, I'm a lawyer, and I left the practice of law 20 years ago to be a full-time patient advocate and advocate for this emerging field.
Great. Thank you, Bernie. Brianna, can you introduce yourself? We are here also with Brianna Deutsch. Brianna.
Hi there. I'm Brianna, and I'm VP of Political Affairs at A4LI. And prior to joining A4LI, I worked in the U.S. Congress in both the House and the Senate, and then also in political communications in Washington, D.C. And I became really interested in this topic of longevity medicine because I was working on Capitol Hill, and healthcare reform was always one of the major issues that we're working on. And I just felt like there was something missing from the conversation. We were never talking about what actually makes people sick. And that led me to write a book advocating for the US government to become more involved in longevity biotech and to help propel the industry forward. So that sort of led me to join Dylan at A4LI. And simultaneously at the moment, I'm also a student at the University of Cambridge studying public policy.
Great. Thank you, Brianna. And last but not least, Andrew Steele. Andrew, can you introduce yourself?
Hello, thanks Dylan, and thanks everyone for coming along. I'm Andrew Steele. I'm a scientist, a writer and a presenter, and I guess a campaigner as well. I actually started out as a physicist. I got a PhD in physics before deciding that the biology of aging was the single most important challenge facing humanity and the single biggest challenge facing scientists too. So I switched fields to computational biology and worked for about 5 years as a biologist. And during that time, I found out that even biologists don't necessarily know that much about aging and decided that I needed to write a book about it. So I wrote a book called Ageless, The New Science of Getting Older Without Getting Old, which sort of outlines the huge potential promise of this field of aging biology and why I think it's such an important topic.
Let's get into our first topic here. One of the things the Declaration of Independence says, sorry, Andrew, but one of the things the Declaration of Independence says is life, liberty, and the pursuit of happiness. So the founding of this country was based on the premise of protecting life, right? So, that in my mind is the, a motivating factor for why the government should be involved. It's in the founding of our country, should be involved with this effort to, extend healthy human lifespan. So let's talk about the government's role in unlocking longevity medicine. So over the last century or so, the human lifespan has doubled roughly, right, from about 40 to about 80 in the U.S. and in the developed world. That's all fine and great, and I believe the projections over the next couple of decades is that will continue to increase the life expectancy. But the main thing that I think a lot of people are concerned about is their health, right? They want to stay healthy as they continue to get older. All people of the world are living longer, but not necessarily better. So can we discuss maybe some of the underlying reasons for why people are getting sick and why the amount of time people live in morbidity and poor health is not getting necessarily smaller, but actually growing as we continue to live longer. Andrew, I'm going to pass it over to you. What are some of these reasons that we're not living necessarily better, but we're living longer?
I think it's basically the sort of after effects of the aging process and combine that with the effects of the way that our medical system is currently arranged. So if we just sort of zoom out a little, actually, I'm going to start not by talking about illness, but by talking about death. And that's partly just because death is much easier to get a handle on statistically, because someone's either dead or they're not. So there's no, complicated statistical messing required. And if you look all around the world, if you look at all the countries, not just America, not just the developed world, but all the countries in the world, over 2/3 of deaths around the world are caused by aging. So that's over 100,000 people every single day die because of getting older. And what does that really mean? Well, it means they die of cancer, they die of heart disease, they die of dementia, they die of the consequences of diabetes. All these different diseases are what are called aging-related diseases. And what that means is that aging is usually the biggest risk factor. So, you can smoke, you can drink, you can have a bad diet, but ultimately most of these things won't affect you until you've lived long enough that you've accumulated enough of the sort of changes in your biology that mean things like cancer and heart disease and dementia are much more likely. So if you think about those 100,000 deaths a day for a moment, some people aren't that worried about dying because, maybe they won't feel anything, they'll be gone, it'll at least leave behind upset people. But actually, for you personally, it might not be that big a deal. As Dylan said, most people, I think, are really worried about how healthy they are. But if you think about all of those causes of death, things like cancer, things like heart disease, fail to wake up the next morning, they're nasty ways to die. You can suffer for years, you can even suffer for decades with these diseases, and often the treatments are quite grueling as well. So it means that you can end up just stretching out this sort of frail end of life without necessarily increasing what we call the health span, which I think is the most exciting thing when it comes to aging biology, is trying to stretch out not just how long we live, but how healthy we live as well. And I think, again, to a death-related statistic, but I think this really rams it home. If we were to literally cure cancer, statisticians can do some tricks and basically cancel cancer as a cause of death within our statistical tables. And they find that even a complete removal of the biggest killer in the developed world would only add about 3 years to life expectancy. And that's because, if you don't get killed by the cancer, there's some diabetes or there's some heart disease or there's some dementia waiting in the wings because you're already old enough to have a variety of different problems with your body. So I think all of that, basically underlines it's aging that's the real problem here. And it doesn't just cause one disease, it causes a whole range of diseases. It causes frailty, it causes all kinds of things to go wrong with us. And if we want to live better, we need to go after the underlying cause, which is this aging biology that causes us all to get sick.
But what I think, though, is what scares people off of this field a lot is the idea that living longer means you're going to be sitting in a chair in a home, kind of isolated for longer, and that's not what I know you and everybody on this panel envisions. What these therapies will bring. So I'm glad we're setting the record straight here. Bernie, can you talk about the So you've a deep background in the regenerative medicine field, since its kind of really inception or its popularization in the early 2000s. Can you kind of discuss how the government's played a role in that effort by you, and how did they help the development of the stem cell field, or how did they hinder it, and what can we kind of learn from longevity there for longevity there?
As a practicing lawyer, for most of my career, I had an occurrence, a health issue. Way back in 1997, I became a cancer victim. I had colon cancer and survived and went through my treatments and owe my life to biomedical research. Well, as so happens, as a proponent of medical innovation in general, not with a scientific or a medical background, one of the earliest issues that I became, which basically came about 1997 with research of Jamie Thompson, and the fact that cells could be transformed into younger cells, that embryonic cells could differentiate any type of cell in the human body, was a very exciting area of research, extraordinary. And President George W. Bush, in his first speech in 2001, about a month before 9/11, raised this issue and whether there should be federal funding for this type of research. And it was actually very controversial because a segment of the American population, the social conservatives, and certain aspects of what we call the religious right, were very much opposed to embryonic stem cell research, because if you become a human being at the point of conception, and leftover or surplus embryos from IVF would be used and donated to research. If you view these cells as people, these cluster cells as people, it was a moral divide. And this issue was hijacked into the long-running debate over abortion rights in the United States. They're coming to a head now, and the memorable case of Roe versus Wade, which actually was the first year I was in law school back in the 1970s. So looking at that issue and understanding that religious or societal beliefs could be holding back a brand new field of research. After all, cell therapies represents a different pillar of medicine. They're pharmaceuticals, drugs, biologics, medical devices, and this cell therapies, this pillar of medicine, it's a paradigm shift. And there were all these societal issues, and this was going to be held up. So I had handled a notable lawsuit that was related to a group that first claimed they cloned a baby. And that lawsuit debunked the claim. This was back in 2003. And I was invited by the leading scientists in the stem cell field at the inception of the International Society for Stem Cell Research back in 2003. And as being the only patient advocate in a room, a building with 650 researchers, I realized that how is this field going to advance without public support and patient advocacy? And I became the de facto lawyer for the field, debating foes of this research. But along the way, I created a nonprofit organization with the help of leading scientists on the Science Advisory Board, and became involved in every societal issue globally, in the United Nations, in the United States, trying to get more funding for embryonic stem cell research. Later, expanding our purview to all cell therapies, because we're non-denominational, we're universal. It's not a question of one cell versus another, but what will work. And of course, there has to be societal considerations and ethical considerations involved. This involved every aspect of law, society, ethics, science, medicine, religion, you name it. And a whole ecosystem has evolved around this and advancing. At the same time, there's this massive convergence of technologies. So obviously, government is critically important. The billions of dollars that go into research in the United States through the National Institutes of Health, and specifically in longevity to the National Institute on Aging. And think about the money in the Department of Defense and other agencies, and issues about reimbursement and whose ox is being gored if cell therapies or the new bedside therapy. What does that do to the pharmaceutical industry? It's complicated. So over time, I realized that, of course, longevity is a component of this field. Patients are a component of this field, if not the leading group. So that's what I've devoted myself to the last 20 years, is building a movement, not only in the United States and worldwide, to support these technologies and deploy them in an ethical way. And if we succeed, we're definitely going to extend the healthy human lifespan. And who knows, maybe even reverse aging.
That's, I think, the goal, right, Bernie? And, I want to just say, you inspired me to get involved in this field. You really did. Being kind of like one of the first serious people to get involved in advocacy on this field. So, I appreciate all the work that you've done. And I want to just say, you talk about, creating, a wave of advocacy for this field as your goal, as your mission. But, it's only really possible if the other side is willing to listen to the other, the people that we're trying to advocate, this longevity stuff too. So, Brianna, being on the other side of that in your career, as a former staffer on the Hill for a large part of the 2010s, can you discuss? Well, first, can you talk about your book, Finding the Fountain, and discuss why you wrote? What was your desire? What was the reason you decided to write that? But then, can you also discuss, how you see longevity and aging research being, digested or taken on the Hill, as a former staffer on the Hill, what's the general sense of longevity on the Hill? Do you think it has a place there? Do you think politicians are open to supporting it?
Yeah, thanks, Dylan. So real briefly, just sort of building on my introduction, as I mentioned, I've been working on Capitol Hill, and healthcare reform is always a major part of the political conversation, and it's always a #1 issue for constituents, because what's more important than your health? Here in the States, a little bit different in the UK. Oftentimes, when it comes to healthcare, the conversation is primarily focused around insurance coverage. And while that's, important part of the conversation, I felt like something was missing. Whether we're talking about what can actually make people healthier and more productive members of society, or if we're talking about what's actually costing the government and families money, it's these age-related conditions and diseases. So, in the States, for example, if you're over the age of 60, there's 80% chance you're probably going to have at least one chronic condition. And as you get older, the number of chronic conditions that you have will just continue to grow, and they may remain with you, for the remainder of your life. And these chronic conditions are also America's most expensive diseases. So not only are they the most fatal diseases, but they're also costing government and families a tremendous amount of money. So when you take together, both just the amount of money, direct costs for healthcare, and then the impact that it has on the economy. And by that, I mean, people are leaving the labor force, people are less productive. A lot of these chronic conditions can sort of make you immobile, make it very difficult for you to work. It costs, the country in total about $3.7 trillion annually. That's about 20% of our GDP. So that's a big deal. And then if we're also, concerned about government programs, Medicare, Medicaid, a lot of those costs also go towards these chronic diseases, and these programs are becoming closer and closer to becoming insolvent. So I'll say, I don't want to say this is a silver lining, but one thing that I think will make members of Congress, elected officials, and the general public start to pay attention to this more is that, these programs that they're depending on may not be there for too much longer if we don't, find a different way to combat these chronic diseases. And I have to say, and Dylan, you can sort of, maybe build upon this as well. It's been actually, it's been very nice to see how nonpartisan this issue is. I think both members, both sides of the aisle at this point understand that this disease-centric approach to healthcare just doesn't work. When we first sort of set up this healthcare apparatus that we had, lifespan was much shorter. Our lifespans were much shorter. So perhaps people weren't developing these chronic diseases, and maybe it worked a little bit better for that period of time. But as we've all seen, it just doesn't work anymore. And so now you're seeing both sides of the aisle start to talk about what can we do to actually prevent these diseases and conditions from developing in the first place. I do think that there is, and there will continue to be, a little bit of a messaging challenge, because the idea of treating aging itself is sort of a foreign concept to a lot of people. And depending on the way you message it, people may think that you're trying to play God, or it's a little bit unnatural for us to be treating aging. Aging isn't a disease, it's a natural process. So I think, one of the things that we have to be really conscious of is how we sort of discuss this issue with members of Congress, because for many of them, it's the first time that they're hearing about it. So in many ways, this is just sort of the new era of medicine. And that's one way to discuss it. But I think, whether you're someone who's concerned about our deficit, whether you're someone who's concerned about, productivity, just human productivity, being competitive against other countries who are maybe moving ahead when it comes to investing in aging research, and then also just protecting these government programs that so many people depend on. I think everyone can sort of get behind this, as long as we're sort of conscious about our messaging and make sure that we sort of narrowly focus on this issue and not, attach it to other issues like insurance and, other types of issues that might be a little bit more controversial. And you'll find that, even folks like Newt Gingrich, former leader of, the House Conservatives, he's supportive of scientific research because he and many other fiscal conservatives understand that, with scientific research, you get a huge return on your investment. And so I do think that there is a lot of hope, and things are actually, Dylan can vouch for this, things are moving forward fairly quickly.
Yeah. So one of the things I just want to, so I can attest to the fact that this is a bipartisan effort. And it's very nice to see that, we've done a couple polls here at A4LI, and it seems that, even though there may be some slight differences, it's, both Republicans and Democrats support this, over 50% of Republicans and Democrats support this. So that's very nice to see. But one of the concerning things of, with the poll that we did most recently was that I think it was something like 25% of people have heard about aging research, longevity research in general. So, it's difficult to get politicians to, seriously take this issue. It's difficult to get them to take this seriously if, their constituents aren't talking about it, if it's not something that's, pressing and urgent and in the news a lot. Right. And so, one of the goals of A4LI is to, educate and, get this message out to the masses and try to, create a social movement to try to create a political movement, get constituents talking about longevity, which will, permeate up to the politicians and get them to act on it. Right. So, Andrew, this question is for you, being the great science communicator you are. With your book and all the shows you've been on, how do you think we win this messaging campaign, right? How do you see longevity being packaged in the most digestible way? How do you suggest advocates talk about the topic in general? How do you think lay people will get on board with longevity and aging research being a priority?
Well, first of all, thank you very much. But yeah, it's a tough one, I have to say, because I think Brianna's absolutely right that if you don't package it in the right way, I think there's this strange phenomenon where until it's sort of been unpacked in the right way, people place aging research in this very separate sort of moral, ethical category to other kinds of medical research. And I think what you really need to do, the thing that I try and guide, sort of the guiding argument through Ageless, is that this is just regular medical research. There's no difference between something like cancer and that's supposedly a disease, and something that's supposedly a natural process like aging. If you really try and draw that distinction biologically, philosophically, however you choose to try and do it, it basically turns out to be impossible. But I do completely understand the sort of, the instantaneous reaction when you're first presented with this stuff, the idea that you can treat aging itself. People think a lot about immortality. There's quite a lot of unhelpful media coverage because people talk about billionaires investing in this stuff, and it seems like some sort of crazy quest to extend their lives and be able to spend all that huge amount of money they've managed to accrue in the years they've got so far. So I think it's something to be very careful about. But the key for me is just to always come back to health, because I think everybody wants to live healthier. You've really got to dispel that myth, as you said earlier, that this is going to somehow extend the frail period at the end of life. We've got to emphasize that it's being unhealthy is what kills you. And therefore, if you can stay healthy, then you can potentially extend lifespan almost as a side effect. Because nobody wants to live to 120 in the abstract. I think polls bear this out as well. But as soon as you tell them that that's going to be in good health, then people are suddenly a lot more interested.
Right.
And I think the other thing is to lead people through this, what can seem like a huge cataclysmic social change, and really emphasize just how mundane I think it would actually be, even if we were to completely cure aging, which is obviously sort of a wild endpoint. But let's imagine that world just for a moment. I think one of the least strange things, if I was to somehow time travel to the year 2400 and we've cured aging, and a bunch of other technological development has also happened in the intervening time, I think perhaps the least weird thing I would see is a bunch of 150-year-olds walking around not looking anything like the number of candles on their birthday cake. We're going to have all kinds of crazy technological changes that are happening, and the sort of medical side of this is just that you're going to stay healthy. You're almost not going to think about it because you're just not going to have to confront all of these hugely challenging decisions that people, older people are already facing, that perhaps their kids are having to face because their parents are getting older. These things are just sort of, bumps in the road of your life that you suddenly have to confront. And I think the absence of those will be surprisingly boring, because we just, it's going to be nothing to get used to, because you'll just carry on being healthy for that little bit longer. So I think once you've sort of taken people through that argument and shown that it's not some sort of kooky sci-fi, it's not a billionaire cult, it's just regular medical research aimed at curing the diseases that we all fear, then it's not about extending lifespan, it's about extending health span. I think that's the real way to do it. But unfortunately, I don't think there is a magic bullet in terms of messaging. I think you just got to, slowly take people through this, because I'd sort of love to be able to transport myself back to sort of 2010 or so when I started reading about these things myself. I suspect I had a lot of these same concerns, but actually, I've had 10 years to get used to over 10 years to get used to the idea. So clearly, this is just something that takes a bit of time. You've got to message it carefully, but just take people through it step by step. And I think it's not as threatening as it can appear at first.
Sure, absolutely. Well, I had the fortune of learning about this field when I was a very young child. So I had that glimmer of child awe and hope. And, I didn't really have the brain development of an adult. So I couldn't really, critically analyze and try to find faults in it. I was like, oh, this is great. Aging is going to be cured. Grandpa is going to live longer. Right. So and now, I like to keep that childhood optimism too, while, obviously, answering the criticisms and, potential, negatives or whatever they may be. It's good to keep that childhood optimism. I think David Sinclair talks about that a lot in his podcasts of, keeping that childhood hope and aspiration for what's possible and all that stuff. So, I think also, we don't want to overpromise, but kind of, dangling out what's possible and capturing the minds and imaginations of people in almost like a childhood sense is a way to do that too. But Bernie, I want to pass it to you real quick, because you have experienced messaging science for the last 20 years. So can you give your thoughts on what I just asked Andrew? How do we win this messaging battle? What do you think needs to be done?
Well, Dylan, this is actually not easy at all. And the messaging is complex. And what I've learned from the 20 years as an advocate related to stem cells and regenerative medicine is to recognize that each of these ecosystems, if you want to say solar systems, are part of a larger galaxy of competing interests. Some are fine, some work together, and being an advocate of longevity and health span in the United States means more than just raising more money for the National Institute on Aging, even though that's tremendously valuable, and the National Institutes of Health is probably the greatest engine of scientific advancement in the history of man. That's or humankind. One could make that argument, but that isn't going to be enough. And we have to realize what the competitive interests are. So imagine longevity and health span as its own ecosystem. And we have to be able, as advocates, to understand the stakeholders involved. And if I would group them together broadly, I would think about the science and medical societies and specialties involved in this, the academic centers and programs that surround it. Then I think about the governmental agencies that impact more than just NIH. Maybe the rate limiting factor to cell therapies is the FDA. How are we going to be able to get this sooner rather than later with the current way of phase 3 clinical trials? Are there alternatives? I think about all the advocacy groups and medical conditions of which aging is a component and a critical component. And each of these medical philanthropies and disease groups have their own ecosystems, right, and pecking order, including inside the Beltway lobbyists and governmental affairs representatives. So how do we interact with them, and who's on board and who isn't? It's not only government, it's not only the United States, it's international as well. So that's two perhaps large segments of ecosystems. Then let's think about the societal and religious institutions that are involved, environmental organizations, human rights groups. We have that, we have industry. And it's not only the biotech industry and pharmaceutical industry. How about the supplement and nutraceuticals and the massive power and interest that that community involves, the amount of money spent on that? That's a natural constituency for this. But how do we deal with that? And taking a step back before we go forward, when I was thinking about the different types of societal groups, how do we work with the transhumanist groups that are very vitally interested in this? How do we deal with issues like eugenics that are there? And more importantly, distributive justice. How are we going to make sure that this goes to the masses? So on top of that, we have our investor class, philanthropists. We think about conferences, facilities, influencers. That's just one part of big ecosystem. But now to complicate matters, think about the ecosystem that exists for regenerative medicine and stem cells, my specialty, AI and machine learning. That's going to change everything. How would that apply once AI comes and develops? If you think about Max Tedlock's book, think about it and how that might impact the regulatory world. Space and the research in microgravity, where is that ecosystem? Popular culture, tremendously influential in this. The zeitgeist is that the zombie apocalypse is going to happen. That's a whole area of science fiction, apocalyptic science fiction. The scientists are usually the enemies there. We've destroyed the environment, et cetera, et cetera. And finally, one that I'm sure none of you have thought of is workforce development as a priority. Where are we going to train the biotechnology workforce that's actually going to do the science and the technical? There's a tremendous lack. The NSF is investing millions of dollars in this. And there's a whole community of community colleges with biotech technical forces. So when you think of this as a vast societal enterprise and where the energy is for the longevity movement, very much Silicon Valley and major investors, how do we harness the energy and enthusiasm of that crowd at the same time recognizing the unmet medical needs there? I would suggest to you that this is it takes a lot of nuance, it takes a lot of understanding, and it means embracing a larger ecosystem and bringing them to this movement. And what's so great about the Alliance for Longevity Initiatives is that you are trying to bring these enterprises, these segments of society together, and also devising the right solutions so our advocacy will actually move the needle. And that's a whole nother conversation.
I appreciate that, Bernie. And I just want to say one thing about there is an increasing amount of acceptance. I see there's more and more the influencers out there talking about aging and longevity. I think Tony Robbins just came out with a book recently. There's more and more influencers getting out there. I'm forgetting which actor too. Chris Hemsworth maybe just made some big Instagram post about longevity or something like that. So I'm starting to see it permeate mainstream media more and more, which is very exciting. And I don't expect that to lessen over the next couple of years. But specifically at A4LI though, we see the value of influencing and talking to political figures because they represent a lot of people in this country and have a lot of influence over their certain sect of people, and that's a great way to kind of move the needle in of itself by getting those talking heads to be in favor of this, right? So Brianna, I just wanted to ask you, specifically from the lens of a political staffer, what kind of messages do you think we as advocates need to develop and say in order to get the attention and interest of someone that you might have worked for or worked with?
Thanks, Dylan. Before I get into that, I just have a quick comment to sort of build on what Bernie and you were saying, because as Bernie outlined, it's many things have to happen at once. It's very complicated. There's a lot of politics in politics. And that's not just on Capitol Hill. I mean, that's a whole sort of community of Capitol Hill. And so that's something that we always have to consider. I do think that, we can't necessarily depend on this, but I do think once something actually works, that's really move the industry forward. So I know, I've spoken to people who grew up in the 1960s, and when moon exploration, the moon landing happened, that encouraged so many people to become astronauts, to get involved in space exploration, and it really moved the industry forward. And it was, something that happened that mankind didn't really, think that they could actually do before. And I think sort of the industry of longevity is the same. Once we have something that works, I think you're going to encourage a lot of, it's going to encourage a lot of students who would maybe focus on a different area of science to get into aging research. The general public will become more aware of it, and then as they're aware of it, they're actually our greatest tool and weapon, because I think there's this misconception that members of Congress don't listen to their constituents. And actually, they most certainly do, because at the end of the day, you can be a lobbyist or a political organization with a lot of money, but at the end of the day, what matters is votes. And if your constituents are demanding something, whether it's from, writing in letters or calling the office, or what they're demanding at town hall meetings, that member of Congress is going to hear what they say, and they're going to listen. So again, we can't necessarily just depend on something working immediately, because we don't know exactly when that will happen. But when it does, I think that's going to really move the needle at a much quicker pace. And here at Cambridge, we have a longevity society. I know Oxford has one as well, and I'm sure other universities here in the UK and back in the States have them as well. So it's beginning to grow in academia as well. But I do think, and Andrews can sort of speak to this, I'm sure, we do need more of the brightest minds getting involved in aging research. But Dylan, back to sort of your original question about messaging. I think we need a message to members of Congress, but what we also, as I just mentioned, what we need to focus on is sort of building out our apparatus to focus on the grassroots, and really reach those constituents. And sort of there is this sort of information gap where we can all sort of recognize that, we get cancer, Alzheimer's, heart disease, all these diseases, frailty, when we're older. But even though it seems sort of common sense for people who have been in the longevity industry for some time, we sort of see the connection between aging and these diseases. And it just makes sense to treat, the actual decay, breakdown of our body as a way to prevent these diseases. But, the general public hasn't really thought about it in that way. So I think sort of, as if we can just sort of explain it in this common sense way, again, not really even necessarily talk about it as treating aging, but just sort of as preventative medicine, preventing sort of the breakdown of your body. People will begin to be more and more interested in that. Everyone knows someone who's had a chronic disease, or they may currently have one, or they know someone who's died of a chronic disease. So it's something that the, constituents from all around the country, regardless of political parties, can get behind.
Yeah, absolutely. I was just thinking about the one thing you said. I was talking with Nir Barzilai the other day, and he was talking about his TAME trial, the metformin trial, and he was talking about how the FDA reviewers were shocked how metformin had all of these preventative effects for, obviously all the age-related diseases. And he mentioned, he was like, they can call it whatever they want, but like at the end of the day, it is aging. But like if they want to call it multi-prevention medicine and not aging medicine, that's fine by me, as long as as long as the audience can stomach it. That's all that matters, is moving these drugs and medicines forward. So I agree with you. I think we need to present it in a palatable way, not too complex. I'm glad we have Brianna involved with A4LI, because she's very good at messaging and very very smart and helpful in that arena. Very very helpful. So thank you, Brianna, for that. We're coming to close to the end here, so I want to go down our last two topics real quick and just get comments from each of you. In regards to what the government can actually do, we talked about more funding for aging, foundational aging research. That's what, one of A4LI's initiatives that we push for. We talk about, reforming the FDA, creating designation for longevity medicine. But I kind of want to dig deep here with all three of you smart people on this panel together. Can we think of some other initiatives that potentially would be beneficial to the longevity industry? And if not, can you explain what you think the benefit of something like increasing funding would, what actual impact would that have on the field? But what I would prefer is we try to think of some other solution. So I'll let you guys think for another second. But if you let's brainstorm a little bit here. And I, I'll get it started. So one of the things that we were discussing and that I didn't think of when we were talking with Newt Gingrich was getting the CBO to run a study on the longevity dividend. And now, and the idea there is, if they were able to produce their own numbers, they would be more inclined to, follow the, suggestions that you were making about longevity, right? So, let's try to think of some things like that. Andrew, I'm going to pass it to you because I know you're always quick on your feet.
Well, what I'm going to do is I'm unfortunately going to repeat what you said about funding, and I just want to ram home quite the sort of scale of the importance of this, because I think it's easy to put it alongside a bunch of other initiatives, right? And I understand why you're trying to do this and trying to get new ideas, but let's think about what the NIA's budget, the National Institute on Aging's budget, actually looks like. It's about $3 billion a year, which sounds like a reasonable amount of money. But you've got to remember that's just a tiny fraction. It's about a tenth of the overall National Institutes of Health, in spite of the fact that aging causes about 85% of deaths in the US. So it doesn't make sense even on a sort of purely numerical terms. But actually, it's even worse than that suggests, because the NIA, there's a sort of running joke in the aging biology community that NIA doesn't stand for National Institute on Aging, but stands for National Institute on Alzheimer's Disease. And that's because about 2/3 of that $3 billion budget goes to dementia research. Then another sort of $1.1 billion goes to various other programs in the NIA. All this is important stuff, by the way. This isn't research I'm suggesting we should scrap. Looking at social gerontology, looking at how to adapt people's homes, for example, to help them, carry on even though they're becoming more frail. This is all really important. What this sort of whittling away of the budget means is that the actual amount left over for fundamental aging biology is about $350 million a year. So that's a little bit more than $1 per American. And, this is a collection of, changes in my biology that have about an 85-90% chance of killing me by the time I get older. So I'd probably want to give more than $1 a year to try to work out what's going on. And to think about this from a more sort of policy perspective, there's an awful lot of stuff in aging. As Brianna says, we haven't got a drug that we can say definitely slows down aging yet. And although there are some drugs, things like the TAME trial for metformin, where we can get to the point of clinical trials, there is some big investment coming in from people like venture capitalists, Jeff Bezos and Yuri Milner and various others sinking $3 billion into Altos Labs. That's a ringing endorsement of certain parts of the field, being at a point where perhaps you could think about commercializing them in the not too distant future. But if you think about, in the book, I break it down into 10 what are called hallmarks of the aging process, these different factors that conspire to cause the various different diseases and frailties and so on that happen as we get older. We've probably got quite a bit of money going into senolytics, which is one particular class of therapy. There's, this $3 billion investment in Altos Labs is going after the epigenetic clock, which is another factor of our aging biology. That leaves 8 hallmarks that I think are still really at the basic science stage. A lot of the investment that's needed is to understand how they change as they age and understand, the sort of effects of different ways to intervene. So although, with apologies again for not having come up with an original solution, I just think this is so important. $1 per American, you've got to, properly internalize quite how little government funding aging biology gets. And I think that should be, any other initiative should be a distant second to try to increase the funding pot.
I'll just say, the 350 million, I always know that number but when you say, $1 per American per year, I think that hits home a little more. So I think I might steal that from you, Andrew. That's good.
Well, yeah. So I mean, building off what Andrew said, if we sort of think about what is the best way to spend our government dollars, let's just think about COVID for a second. So there's been some estimates just talking about the US specifically that COVID as a whole so far has cost the country about $16 trillion. And that's the dollar amount. Let's also talk about the number of lives lost. And with Operation Warp Speed, for the first time in history, we were able to, through a private-public partnership, get a vaccine in a very, very quick amount of time. But here, and that's great. And that just shows that when you get the government and industry on the same page and they're working hand in hand, that shows you the amazing progress you can make in such a short amount of time. But here's the truth about the vaccines. Vaccines cannot solve a broken immune system. So if you are a older person, you should definitely get a vaccine, but at the end of the day, you are still at risk. And I think, the statistic is something along the lines of, if you are 85 or older, you are 330 times more likely to die of COVID than someone between the ages of 18 and 29. So, I mean, the evidence is there. And if we had worked on combating aging and combating, the decline of immune systems, think of how many lives we could have saved. So I think if I had a genie and I could make a wish, it would be to have something like an Operation Warp Speed, but for aging.
Absolutely. And, I'll just go back to what, COVID, the amount of deaths and all that stuff and how it affected the elderly, and specifically my grandfather, is what drove me to get into this field. So, obviously COVID is a horrible thing, but, hopefully the longevity community can use it as motivation to move forward faster, because we need to be prepared for the next pandemic, right? And I actually believe A4LI's sponsored BioAge just came out recently with some study about how their immune age drug would have lessened the effects of COVID. I forget the exact numbers on it, but there is a lot of work in that field, especially in the longevity field, about immune health and how it affects COVID. So it's important for the next pandemic, and we need to make people who were so affected by COVID understand that this is another route we can take to lessen the effects, right? So Bernie, I'm gonna just give it to you real quick here. What would you like to see the government do to increase life expectancy in the U.S.? I guess that's what this question has become. We talked about funding. Can you talk on about funding a little bit? What's the importance there? And if you have any other thoughts on what A4LI and other advocates should be pushing, can you speak on that?
What has COVID taught us? It has taught us a lot of distrust in public health and the way medicine and health and vaccines are communicated, and a tremendous lack of understanding, even in a time of a global crisis. So how do we take that environment and the understanding that our system of regulation for drugs and biologics do not make it easy? It makes it decades and tremendous expense to get something new and approved. That's a challenge. And I think our direction is not only funding for basic research, which is critical, which the National Institute on Aging can certainly improve with more money, but it's looking at the regulatory system itself and how it's going to accelerate and be able to take the new tools that are coming available, artificial intelligence, how we can use organoids and diseases in a dish, how we can get real world data. All of this is critical. So when I look at it, it's a matter of what's going to accelerate translation of fundamental research into actual medicine. That's where we can have a strong focus in seeing where the system is broken down, how it can be accelerated, whether it's for improving funding for FDA, encouraging interagency communications related to aging, of which I think exists on levels today, but to expand it and lift the curtain on it so the public and advocates can be involved, and largely getting the patient's voice heard in the aging and longevity and health span field. That's a tremendous unmet need. And because when we can fight for improved diabetes research and to cure diabetes, tie it in to what that means for aging. And just the final point, if yes, the longevity dividend is fantastic, we have to get that established by the academics, by the economists. If everyone can salute the idea of longevity aging, that would be a tremendous accomplishment in and of itself and would help propel this whole field.
Absolutely, absolutely, and you know that like that's why I like the idea of that Newt Gingrich proposed so much, because you know getting the government to produce their own data makes it almost as if they can't refute it. You know, it's their own data. So, so yeah, that's all great. So, the last thing we're going to go on here, just a minute or two from each of you. You know, I want to talk about the future. I want to talk about what you see the world looking like in 10 years. You know, what does the world of health and medicine look like to you in 2032? Do you have any specific thoughts? Andrew, I'll let you start first.
Well, I really hope that in the next 10 years, we're going to have at least some of these longevity medicines. I think that's going to be a really exciting change, because we're at a point where, you know, we have got a few drugs like metformin that are ready for phase 3 trials. We can roll these out, we can give them to patients, we can see if they work. And, you know, fingers crossed that some of those early attempts do work. And sort of snapping at their heels are the senolytics, these drugs that kill the senescent aged cells that accumulate in all of our bodies as we age. And what we'll probably see is at first they're going to be used for specific diseases where we know that the senescent cells are an issue. This is partly because of the FDA sort of issue, I guess, the fact the FDA is going to struggle to approve drugs that are preventative treatments for the aging process. But secondly, because senolytics, we've got to remember they are new medicines. They are things that haven't really been tried very much in humans before. There are 20 or 30 companies trying to turn these things from, you know, an idea that works in mice to something that works in humans, but they're still an experimental therapy, and that means they're going to start in people who've got serious diseases, perhaps diseases that don't have a particularly good prognosis, don't have a particularly good range of treatments. And if those drugs prove effective, so they remove the senescent cells, they improve the health of those patients, but most importantly, if they prove safe, then we can start thinking about widening the sort of range of people they're prescribed to. And so we might start giving them, you know, rather than people who've got lung fibrosis, which is a very serious age-related disease, seems to have senescent cells, you know, all around the area where the fibrosis happens. Perhaps instead we can start giving it to people maybe with advanced heart disease, so people who are in a slightly lower risk group, a group that already has some workable treatments, but, you know, happy to take a punt having seen that it was safe, and so on and so on. You know, you can cast the net wider and wider. And I very much hope that by 2032 we'll at least be thinking about giving these drugs as a preventative measure. You know, maybe people are 50, maybe people are 60, and you know, we understand enough about how these drugs work and the aging biology to think about saying, oh, you know, you've accumulated a lot of these senescent cells, maybe we should clear them out preventatively. And I think the field of aging biology is just going to come on in leaps and bounds as well. There is this real excitement around it. People are starting to learn about it. And I think one of the crucial things that has really become possible in the last sort of 10, 15 years as well is the data. We're just going to be on a, you know, sitting on an absolute goldmine of data. It's kind of ridiculous to me, actually, how little we know about which tissues in the body senescent cells accumulate in. We know where are the most important places, where do they have the most effect, where do they appear the most often. But the fact is, because of, you know, these omics technologies, things like genomics and proteomics and, you know, single cell sequencing and all these kinds of things, we can dig into you know, tissues and whole organisms in ways that we simply could never do before. And of course, computing power, artificial intelligence is going to continue to advance. So I think that's going to be really, really exciting, sort of pushing the frontier further and further forward. And finally, you know, I very much hope we're starting to see the first thoughts about stem cell and gene therapies. These are things that are very much at the cutting edge now. Again, they're being, you know, handed out to patients who've got very serious problems that, you know, are therefore willing to take a punt on these more experimental ideas. But actually, we've got some great ideas for stem cells and for gene therapy that could ameliorate the aging process. So once those, you know, once we've understood things like the delivery platforms for gene therapy, I'm very excited to see what we can do about aging with those as well.
Excellent. Awesome. Thank you, Andrew. Bernie, can you answer the same question? How do you see the world of health and medicine? How do you see that whole world looking in 2032?
Well, it actually depends whether the zombie apocalypse and all the bad things and all the black swans that we can't anticipate don't happen, right? All the negative things. Now, if the field that we're talking about is a good black swan, and if AI comes into fruition in a benevolent way, and if we are able to solve and find ways to improve the regulatory process and get these new medicines and this new revolutionary convergence of technologies to work in a cohesive way, then we really might get the answers that we need, because the basic science is pointing to practically elixirs of long life, right? That we are actually able to take an aged cell and reverse it to an embryonic or young cell. We're doing this. Apply that to all animal life. What are the implications? So if we can figure it out that it doesn't destroy us, we can have that existential hope that we will all be living to a very, very old age. And hopefully our robot minders will take good care of us. I'm optimistic. I'm a proverbial optimistic, but at the same time, I've lived long enough to be prepared for anything.
Brianna, can you end us off here? How do you see the world looking, the world of health and medicine looking in 2032?
Yeah, well, first I agree with everything Andrew and Bernie said, but I think one thing that I not only hope for, but that I think is actually possible is that we begin to sort of see this shift in the healthcare paradigm from this disease-centric approach to more of a preventative approach. And in that way, healthcare will start from the day you're born. You don't just start worrying about it once you develop these chronic diseases. And I should mention that we talk about these medical treatments, and those are going to be extremely important. But also, lifestyle is part of this. I don't think you're going to be able to eat chicken wings all day and sit on the couch and then still expect to live a long, healthy life. And we all know that obesity and some of these other diseases are all comorbidities and they accelerate aging. So we also have to sort of focus a little bit more on healthy lifestyle habits. But yes, so sort of building off what everyone said, we need to see this paradigm shift. I'm really excited to see what AI can do for drug discovery. I think in many ways, the human brain, the human body is more mysterious than the bottom of the ocean or the outer edges of outer space. There's so much we just don't know. And once we can really have a better understanding of how our body works, how our brain works, I think these treatments are going to develop much more quickly, and there's going to be more precision medicine because we all know that we all function so differently. So like Bernie, I'm an optimist. I'm very excited about the future. I also, I'm practical. I think there's certainly going to be some challenges. You never know what sort of curveballs like COVID may come along. But I think because the longevity community continues to grow, I think that, that's a good sign for the future.
Absolutely. And, progress is can be cyclical, but, it seems that, we're trending upward, right? So, we might have our, in the short term, there might be little roadblocks like COVID or things like that. But, I think everybody here would agree that, we're society and technology, we're definitely moving in the right direction. So I'm also an optimist and hopeful for 2032, no matter what happens. Even if we do have robot handlers, I'm sure they'll, be nice to us and all will be good. So, and that was a reference to what Bernie said. So yeah, so this was great. I'm really glad I got to get all three of you with your busy schedules on for this session. And I want to thank you for your time. Thank you, Andrew, Bernie, and Brianna. I will see you all soon. And thank you for everybody who tuned in to this session of the World Stem Cell Summit. See you guys soon.